Dr. Murphy, Chairman of the Oversight Subcommittee.
Thank you, Madam Secretary, and welcome. You had mentioned that the people who did the technology and the website made a number of mistakes. You mentioned Verizon. When we had them before our committee last week, they said it wasn't their fault. They were told within HHS there were some problems there.
Sir, Verizon wasn't involved in the website. Verizon hosts the cloud.
Right, with the data, I understand. I'm sorry.
Not the website.
But they had a role, CGI had a role, others at the companies, et cetera. I'm just curious in this process, what decisions did you make that affected this for better or worse in terms of the data, the ease or problems with enrollment, and being able to track how many people are actually enrolled?
My decisions specifically to design the website, I was not involved. I am prohibited to choose contractors. We go by the
Sure.
federal procurement, and I got regular reports on exactly what was done.
But what about the part with regard to getting data in terms of how many people are even enrolled or trying to enroll? Did you have any decisions in that process?
The application process at this point does not work end-to-end.
Right. I understand it doesn't work. That's obvious.
We do not have reliable data about the end.
I'm just trying to find out if you had asked them to say, look, I'm in charge of this. I'm going to want a regular report. How many people have tried to enroll? How many people have enrolled? Did you ask that question
We
in the
have
planning?
prioritized for our contractors that specific fix, and believe me, the insurance companies are eager for us to get reliable data to make sure that their data matches ours, and that is not there yet.
I appreciate that. I'm just trying to find out if you've told them that was part of the plan of what they're doing. Let me, real quick, we're hearing from thousands of people who've had their policies canceled. In fact, I heard from one insurer in Pittsburgh that just canceled 30,000 individual policies. Now, they said they expect 50,000 to 30,000 to enroll in the exchange plans. Just so you know, to date, so far, the number of people who have signed up for their plan is 10. 10. Now, I'm concerned a lot of these individuals and their families aren't going to be able to make it by January 1. So I'm wondering, do you know how many families will not have been able to keep their insurance by January 1? Do you have any matrix that can help you understand what that number is going to be?
Sir, by law that has been in place for a while at the state level, insurance companies must give their customers a 90-day notice about a policy change or a plan cancellation.
I'm just wondering if you have a mechanism whereby you will know. Is something built into the system whereby you'll be able to...
I know if your constituents signed up for an individual plan.
People across America. And do we know how many policies will be canceled or re-enrolled? I mean, is it 1,000, 10,000, 1 million, 5 million? Do we know?
We know that in the individual market, a number of the plans being sold are not grandfathered and are not currently meeting the law. Those notices have gone out. We know that there are about 12 million people in the individual market. A number of them have grandfathered plans. A number of them have plans which meet the essential health benefits. So I can try.
Well, let me put a face on that. A person named Paul wrote to me and says, I'm supposedly one of the families that this act was supposed to help, but it's in fact hurting more, would make it harder for my family to live. We'll have less money for food and other essential items. I have a wife and 4 children to take care of. Another person wrote, I had a 2013 plan, which if you include the premiums and out-of-pocket total liability was $5,300. For 2014, the same program liability is $9,000. Single mom writes, I want to convey I'm one of the millions of people who's having their health insurance canceled because it does not meet the standards of Obamacare. I liked my insurance. I especially liked the price, and now I'm being forced to sign up for something that it will be way more expensive. As a single mom who's self-employed, I'm worried about how I'm going to pay my bills. I hope you have a mechanism to track who these people are, that she's not eligible for other subsidies, but the costs are really going to be driving her down.
Well, sir, again, I would suggest that there is no requirement that any of those consumers sign up for a plan suggested by their company at a higher price. They have now options.
But if a plan changes it,
health underwriting, without pre-existing conditions, with some guarantees around.
She's searching around and she can't find a plan she can afford.
They never had before.
She can't find a plan she can afford.
Gentleman's time has expired.